Welcome to the Healthy Careers Podcast, where we help healthcare providers succeed on purpose. We take a conversational approach in learning from others who have been there and done that. Join us as we share expert insights from real people who are just like you, because we believe that success isn't just a destination, it's an intentional journey, and you don't have to do it alone.
All right. Welcome back to the Healthy Careers Podcast. I'm your host, Madison Loomis. And today I have a fantastic guest, Michele Cambron. She is a PA and she also does something outside of that, which I think is incredible. I will let her introduce that. She is in clinic as an occupational medicine. Am I saying that correctly? PA. Mm-hmm. And she also, though, has a fantastic channel, and I will kick it over to her to explain what that is and why she does that.
Well, thank you so much, Maddie, for letting me be here today. Hi to everyone out there. As Maddie said, I am a PA. I went back to school as an older person. I've been working for about the past 7 years as a PA. Lately, I've been doing just more sporadic locums in occupational medicine, but my background is really family practice and a little urgent care. A short stint as a hospitalist. So I've done a little bit of different things along the way. But I started a YouTube channel, which totally surprised me in my mid 50s. You know, I decided that I was going to do this, but it really was born out of my struggle to find my fit in medicine. Because as I said, I've done a couple different things, but haven't really found, I think, where I really belong in medicine. And so as I was looking for what that answer may be, and I was struggling with some burnout, I thought, you know, I'm not the only person out there that's doing this, that's having issues. So I thought I would just take people along with my journey and show them what I discover along the way.
I think that's fantastic.
And I don't know if I mentioned, I don't even know if I mentioned the name of my YouTube channel. It's called The Medicine Couch. Because I always forget to do that. Tell people what it is.
Yeah, I know, right? I always forget to introduce myself on my own dang podcast. So I get it, you know, but I think that's incredible. And I've watched some of your videos, and obviously I'm not a clinician, but it's so successful. I mean, you look at the views and everything, clearly what you're doing has gained traction and a following of people that I think are also in very similar positions to where you are at. And I think that you've also been able to shed light on folks who maybe felt like, what am I supposed to do, right? What are the next steps when they have gone into a position where it's not the right fit? And they don't know, you know, what am I supposed to do? Is it me, right? Like, am I not fit for this role? And I think everybody has a little bit of that imposter syndrome where it's like any job. Sometimes it's just not a good culture fit. And sometimes it's just not the right clinical setting or the right setting in general. So I want to dive a little bit deeper with that, you know, today, because I think that you hold so much knowledge and insight for folks who may be listening to this and thinking and having the same experiences.
Yeah. And I just wanted to say that for anyone out there listening and watching, imposter syndrome is real. And there are tons of people struggling in medicine, because sometimes that's hard, right? We look around and we think everyone else has it all together and they know what they're doing. And I'm the only one struggling. And I highlight that on my channel. I share my own stories. I interview, I have a video actually coming out, I think next week, from when we're recording, with somebody else sharing their struggle in medicine. So that's the first thing, is to let people know that they're not alone. They're not the only ones struggling. And this is a difficult thing to get right.
Yeah. I think anyone in general that's in healthcare over the last few years, COVID era and post-COVID, if they have gotten into the profession in the last 5 years, let's call it, right, has seen a lot of this burnout because of just the true demands that are on, you know, healthcare professionals in general. But then on top of that, just the supply, the shortages, right? Everybody is burnt out. Even if they're happy, they're burnt out. They're like, dang, I wish I could have a little bit more work-life balance. So I think it's so key to talk about these things and be open and honest and share our stories, because then somebody that feels like they're alone might think, oh, I'm not the only one that's going through this, and there are other options for me. So I'm excited to get into things for sure. Awesome.
All right. Me too.
So I guess I saw where you have highlighted and talked to folks who have done something that either they're burnt out or they have figured out that clinic the clinical side of things is just not for them, right? Maybe they have been in the clinical side of medicine for 15 years and they're ready for a change, or they've been in it for a year and they realized, I want to make a change again. I don't think this is for me, but I don't want to atrophy on my skill set or the knowledge that I've just spent X amount of years gaining. So if you can kind of explain to us how you got into that, and then maybe we can talk about a few different avenues or options that people have.
Sure. Yeah. Well, like I said, I was struggling to find my fit in medicine because having gone to PA school and coming out, I learned basically that you work in primary care, maybe urgent care, or you work in a specialty, right? And
Mhm.
that's what our options were. I mean, I kind of knew that teaching at a PA school was in the cards maybe eventually, but I thought you had to have like years and years of experience and be a real expert, maybe even have a
Yeah.
doctorate before you can even step into those roles. And so I just felt like those are my only options. I just had to choose,
Mhm.
which clinical setting I wanted to work in. But it's hard to do that when you don't get a lot of rotations. And
Yeah.
rotations are kind of luck of the draw, I think. Mine, I didn't have a whole lot of variety in my rotations. I had just a ton of family practice, really,
Okay.
and cardiology, a surgical specialty. But I didn't know what it was like to work in orthopedics or in
Sure.
rheumatology or anything. So I was just kind of lost. And after my first two jobs weren't the right fit and I left those, I was pretty gun shy about getting into another practice, right? Because
Mhm.
it's a lot of work. It's a lot of paperwork and time to get all the credentialing done. And it's hard on the
Yeah.
practices and the patients to bring in a provider who's then going to turn on and leave. So I was
Mhm.
like, God, you know, I don't want to get in that situation again, but I don't know where to turn or what to do. So that's where I was. Excuse me. I was really kind of just lost and unsure. So I just decided to
Mhm.
work locums because thankfully I didn't have to work, constantly 40 hours a week every week. I was in a good position where I could take little breaks in between my assignments, which I
Sure.
loved. And if anyone, is burnt out and has considered locums or in the position where they can work locums, that's kind of a nice thing about it because you can control how much you work. If you're tired of working, you can pull back for a little
Yeah.
while. And it's just nice to have that change and that variety. But I
Yeah.
didn't really think I wanted to work locums for the rest of my career. So I, was looking for the specialty that would work for me, and I tried to find resources, but that's really hard for PAs and NPs because most everything out there is for physicians. I bought a book
Yeah.
about choosing medical specialties, but it was all about them and what they can do and how much they make, and it just left me with a lot of questions. I'm like, oh, I don't know as a PA, like would I be able to do like some cool procedures in this specialty or what would I be able to
Right.
do and things and what does my schedule really look like? So I
Yeah.
started doing a bunch of research and I sent out a
Mhm.
big survey and as I was gathering this stuff, I decided, I wanted to share it with other people. So I started the channel.
Yeah.
And what I love about it is that I just had that such narrow view of what it could be,
Mhm.
what a PA can do, I should say, and
Yeah.
what my options were. I just thought I have these little
Yeah.
things to choose from, which is still a lot. But since I've been doing this channel and talking to people and hearing their stories, I realized that our options are huge. They're
Yeah.
beyond what most of us even realize. So that's kind of how it got started and why I started it. And on my channel, I have different playlists. I have um, all the different specialties. I mean, haven't interviewed somebody in every
Cool.
specialty yet, but
Mhm.
I'm working on it. So the specialties, then there's a playlist for cool and unusual jobs, things that people really never thought about that might be exciting for them and might change things up a little bit clinically. And then I have a
Yeah.
whole playlist of non-clinical jobs for people who are just tired and want to get out of clinical medicine altogether right now.
Mhm. I think
Is
that's
that kind of
great.
what you
And yeah, I think firsthand experience and hearing from somebody that has been there and done that. That's why I have this podcast, is because for me, I learn something from every guest that comes on here. I'm not a medical professional. So for me, I hear day in and day out, I will reach out to somebody about a job opportunity and they'll say, you know what, I actually don't know how much longer I want to be on the clinical side of medicine. And I'm thinking that I might want to move into leadership, or it might look like, do you know how I can do that? And my honest response is no, I don't know, because that hasn't been my world. I live in we hire NPs and PAs that are either, for a PA, they might be in orthopedic surgery, they might be in the clinic. But at the end of the day, yes, I've hired in my tenure corporate executives and people that are higher ups and in leadership, but you don't see a lot of it. And I think that there is also a huge shift right now in healthcare in general. And I love it. I love that it's shifting this way, where instead of hiring outside executives that have never been in front of a patient, people that are clinicians are going back to school, getting healthcare administration, MBAs, different degrees that allow them to have that seat at the table. And then that approach to how they make decisions for the hospital, for the practice, is based on real experience. It's not based on just looking at data and saying, okay, let's make this decision based on this. It's saying, hey, I know the numbers show this, but having been in front of patients and hearing their concerns and knowing how this works on a clinical day-to-day. And I think the more that we as clinicians, and I say we, I'm not a clinician, right? But the more as clinicians, just for the sake of this, conversation.
Right. Yeah.
The more that step up into that role, the better advocation and the better decisions we are going to have towards patient outcomes and quality of care, rather than just hospital executives pushing revenue or pushing profit that, headlines recently have suggested aren't even going into the right places anyway.
Right. Yeah. I think that a lot of them are learning it's a whole different ballgame than what they thought, they take their business mind and they go into it. And I think that's a great point. There are a lot of reasons why it is good and right for clinicians to move into leadership roles. And I think that that is what needs to happen in medicine, because I think that the business people have taken it over. And it's kind of like when you're talking, I was thinking about in school, there's the textbook answer and there's the answer that happens in real life, when you're talking about medicine. And it's like that with business. I mean, there's business things that can apply to medicine, but then there's just things that just work differently because it is medicine. And I think a lot of times you can't realize that unless you're looking at it from a clinician's, viewpoint.
Standpoint.
So, yeah. And so I think that and I want to talk about that in a little bit, clinicians moving into non-clinical roles, especially like leadership. But before we even think about that, I just do want to say that it is scary if anyone's paying attention to the landscape out there and what's happening right now. For me, I'm nervous about what's going to happen in the next 5 to 10 years, because from all indications that I can see, people I talk to, articles I read, I hear other people's podcasts, like you said, a lot of clinicians are ready to jump ship. I mean, not just providers, but nurses and, techs and everybody. There's a shortage already. And I feel like that's just going to get worse. And it's scary because all of us need medical providers at some point in our life, and so it'll be scary if they all leave. So while my channel, I talk about ways to move into non-clinical roles. And let me also just say, I don't think there's anything wrong with that. I don't think that just because you studied medicine that you should feel obligated and tied to stay in that particular role. We're human beings. We, evolve and grow. So I don't think it's wrong if clinicians want to move out of, the clinical setting. But I would like to address for people who maybe really like clinical medicine and would stay in it, but they just can't keep doing what they're doing, and they're seeing way too many patients or being asked to see way too many patients and being buried in paperwork and just in settings that they don't really enjoy. I do think for those people, there are other options other than just jumping ship and going the non-clinical route. So like I never thought that before, honestly, going into this channel. I thought, either it's medicine the way it is and it's crappy, or you get out of it and do something a little bit different. But having interviewed people, like I interviewed a PA who worked for the winter down in Antarctica at the South Pole Research Station. So for 9 months, he was in this research station. And,
Yeah.
no sunlight during most of that time. They can't leave.
I'd go
You
crazy.
can't really get planes in and out. But he talked about what that was like and what you did as a PA down there and about what it was like
Mhm.
living at the station and things. And honestly, by the time he got done talking, I was like, sign me up. Of course, I'm pretty adventurous anyway. So
Yeah.
that's I know not everyone would do that. But
Yeah.
if you don't do those
No, not me.
extremes, like yeah, but like some people might want to work overseas. Like the people
Yeah.
might be surprised to know that PAs and NPs staff the medical clinics of U.S. embassies all around the world. So physicians like oversee the territory, which may include several clinics. But the day-to-day
Right.
operations and running the clinics is all PAs or NPs. You can work for public health service and work at NOAA, the National Oceanic and Atmospheric Administration. I interviewed a PA doing that, and he talked about how PAs go out on these research vessels and how they oversee like the dive medicine program and actually
Yeah.
work with training the divers. And as a scuba diver, I was like, that's awesome. I wish I would have known that was an option, when I first came out of school, because some of these things
Yeah.
do have age limits on them, and I'm hitting that where I don't qualify anymore.
No. You scuba dive
Yeah,
though? That's incredible. Not to go off the
yeah,
trail, but I'm
yeah. I'm a dive
petrified of
master,
scuba
actually.
diving. Oh my goodness. That's
Yeah, yeah.
awesome. So how long have you been doing that for?
I got certified when I was 15, actually. I always
Wow.
wanted to be a marine biologist. That's what I thought I was going to do. But
Yeah. Yeah.
I didn't end up going that route. I ended up going, later in life, the people biology side. But yeah,
Hey, that's all
so,
right.
yeah, people deserve, help too. But I love sharks and whales and all the dolphins, those kind of things. So that was always kind of my dream. So working at NOAA, doing something like that would have been a dream career, but I didn't know it existed
Right.
because no one talks about these things in school, right? And where do
No.
you find out
No.
unless you happen to know somebody? And so that's what I tried to do on my channel is find these different things. And I've
Hmm.
always wanted to work overseas, and so I pick a profession that doesn't, it makes it hard to work overseas, but it's not impossible. And
No.
I have videos about, like, you could go work in New Zealand right now if you've got, good family practice experience, like, 3 to 5 years experience, you can go work in New Zealand. You're not going to get
Mm.
paid what you get paid in the US, but still it's a cool opportunity. They don't have quite the pressures that we do in seeing patients. It's a whole different mentality over there. And the PA interviewed talked about just their view on work-life balance, so different than ours. So there's,
Right.
and it doesn't have to be just, doing something extreme or different like that. There are opportunities, just, even within a specialty, to get in with a really
Yeah.
good training center or somewhere that has good mentorship. Because I think a lot of people that have burned out, some of it may be because they've just never had good mentorship and they've never been in a setting where they get, good respect and,
Hmm.
autonomy or whatever it is that they're looking for. So I urge people that if you're ready to throw in the towel on clinical practice, that's fine. But if you still really enjoy it, but you're just not enjoying your job, I urge you to look at like all the different possibilities out there.
Yeah.
Um, and see if there's something that you could do that could keep you in clinical medicine.
Yeah.
But that's just my pitch
No,
for staying
I
in
think,
clinical medicine.
no, I agree. And I think there's also people think it's like you're either full time or nothing at all, right? And I've seen so many
Yes.
people, whoops, I want to make sure my charger doesn't come off here. I've seen so many people, like you said, that are locums and they choose their schedule. And I'm not a huge advocate for locums on my end, just because I see the financial aspect of it doesn't always mean the best for the clinician or the client, but
Right.
it does create flexibility, right? So if that's what you're looking
Hmm.
for, that's an option.
Yeah.
But I also think
Yeah.
too, and I've had this conversation with a few different people of, if you're miserable in your job and you're feeling burnt out, but you don't want to throw in the towel yet, go into the next goal. What's the next stepping stone? And a lot of times in clinical medicine for a PA, it's like, oh, this is it. Like now you're a PA, this is what you do. And you're going to see
Yeah.
X amount of patients per day, and you're going to turn and burn them because the healthcare system in the US is that way. In order for people to make money, you've got to see X amount of patients and you've got to make sure that they're in and out and da 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 da. And so I think it stems from wanting to be challenged and feeling a bit bored
Yeah.
And then because they're not feeling challenged, it leads to burnout, because then on top of all of that, they've got the pressure to
Right.
have, this volume, and it takes
Yeah.
away from at least the quality of care that is probably the one thing that gives them that adrenaline during the day of patient outcomes and building relationships that is just cut short.
Yeah.
So, long way of saying, I think that all of that boils down to have the conversation with your director or with whoever to say,
Mm.
what else can I do or can I contribute, and create a position for me to be able to feel like I'm doing more or I'm feeling more fulfilled outside of just the clinical work. Because there are many
Yeah.
opportunities. They might say, we think we've got to go hire another person to do this role. And maybe you scale back your clinical hours by 10 hours and take on that position and get paid more money to do it, and it's something that you could do from
Yeah.
home. And then there's your
Yeah.
work-life balance too.
Yeah.
So,
Yeah.
and I think so many people throw in the towel before truly exploring what options they have. And they're so quick to say, I'm going to go into
Yeah.
medical sales. And I'm like, well, medical sales is very stressful too, because I work in sales and I have friends that work
Yeah.
in medical sales. And I hate to break this to you, but it is just as stressful,
Right.
just in a different way.
Right. Yeah. And lots of travel a lot of times too.
Hmm.
But yeah, like I know we're going to get to the, want to get to the non-clinical stuff, but just one thing to piggyback on that, like when you were talking about asking what's available, telemedicine. I'm getting ready to
Yeah.
interview somebody in a couple of weeks, talking about how telemedicine has evolved and how PAs can try to work that into their practice. So like even if your practice isn't doing it right now, become a subject expert about telemedicine and
Yeah.
help your practice understand the value of it. And maybe you could even transition to have 1 day a week at home doing telemedicine, or 2 days a week, whatever it is, or just vary your schedule a little bit so that you've got more breaks and can work from home and have the
Yeah.
flexibility that you want. Or like you said, part-time. I have a great video about, is part-time the answer to you? And immediately people are like, well, I can't afford it. And I'm like, well, people in this country live on like $40,000-$50,000 a year. And most PAs, a lot of PAs and NPs are married. They have, a spouse that's also making money. I bet it's doable. It just
Yeah.
may have to realign your priorities. So, and I'm not talking down
Right.
to anybody, whatever people want
Yeah.
to do, but I'm saying there is possibilities of changing, the setting you're in, as long as people like the people they work with and they're being respected and those things. I think it's definitely worth trying to work in the practice. Maybe it's coming up with like new fun initiatives that you want to do with
Hmm.
patients, and something you've been thinking about. Maybe the practice is open to it and you don't know it, and may open up a whole new income for the business, but also be something that you enjoy. And I talk a lot
Yeah.
about niche practices, niching down within the practice you're in, especially like family medicine. I mean, if you just love to do derm and wish you could work in derm and get something else off your plate, maybe you become the derm person for your practice. And if the
Yeah.
other providers don't really like it and stuff like that. So you're right, there's a lot of things that people can do to think about how to make their current practice better and make them feel more fulfilled. It's still going to be
For
stressful,
sure.
but but it could be more
It
enjoyable.
is.
Right?
Yeah. And I think no matter how you coin it, like there's not a lot of clinical jobs that don't involve stress. There's not a lot of jobs in general that pay well with good
Right.
benefits that aren't stressful. I wish there was, because I'd
Right.
be doing it. But
Right.
people might look at my job and say, oh, you work from home and you can make your own hours. But I'm cranking out 60, 70-hour work weeks. And if it's 1 o'clock on
Mm,
a Saturday and somebody needs me, I'm stopping everything to cater to that candidate
right.
or that client. And, you know,
Right.
recruiters work off commission. And a lot of times it's like, you've got to hustle for that money. So it doesn't matter if you're working 40 hours or you're working 80. But
Right.
with all that being said, I mean, I think from a clinical perspective, I think you brought up a good point, because I've actually called my family medicine because I have thyroid issues. And I said, is there anybody there that has worked in endocrinology, or that is either has additional certifications that they've gotten when it comes to female hormones, wellness, etc. And they're like, oh,
Right.
actually, yes, we do. So I've been going to this family medicine, this
Yeah.
primary care, person for 2 years and didn't know that this person existed until I just asked that question.
Right.
And then it was like, oh yeah,
Yeah.
so and so has actually worked with an endocrinologist for the past 7 years before they came to work here. So,
Yeah.
great. I meet
Yeah.
with that person and now I'm a happy patient because I have that
Yeah.
need there. So I mean, I
Yeah.
think advocating, asking, standing up for yourself is the first step if you're feeling the slightest bit
Yeah.
burnout or feeling like the passion is slowly fading away. Cause I think that also can happen
Yeah.
when you feel all the other things of tired and, all the
Burnout.
things that come along with
Yeah.
being a healthcare provider. Yes.
Yeah. Yeah. Yeah, definitely. And I think hormones and wellness, those type of things are something that is going to be a huge opportunity for
Booming.
family practice, yeah, in the future.
Yes.
But then, and I know you wanted to talk about the non-clinical stuff because there is a point though that a lot of people reach and they're like, I've
Yeah,
tried.
I'm done.
I've tried doing different things. I've tried working with my practice. I've tried different specialties or whatever, or they just know, I'm done. I just can't deal with patients anymore for a while. Say
Yeah.
that lovingly if there's any patients watching, but it's just it's difficult, and you have a lot of personalities you have to deal with and stuff. And so sometimes
Yeah.
people just want to get out and work behind the scenes, and so that's perfectly valid, like I said earlier, and fine too. And I've talked to a bunch of people that have done it, and so I'm sure you get asked all the time, well, what then? Okay, people say we can
Yes.
do it, but what can we do?
And most of the time
Uh,
it's like medical sales. And I'm like, I feel like that's not the only thing that you can do. I feel like there's a lot more out
right.
there, but I'm not the person to go to
Yeah.
for that because we're specialized in clinical positions mainly and
Yeah.
executive leadership roles. But I mean, I would love to hear from you because you've talked to these people, you know what other options are
Mhm.
out there and you've gone through that journey yourself. Like, what have been some of those
Yeah.
top ones or things that people can think
Yeah.
about if they are listening to this and thinking, like what other options do I have? I don't know either.
Yeah. 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 Well, just kind of take them in no particular order, but first
Yeah.
one is epidemics, and
Hmm.
um, I think most people know about that. Like I said, but I had the preconceived notion that I had to have, so many things to be able to do that. And granted, PA programs, specifically, a lot of them, especially even when I was going to PA school, were trying to get the staff, the faculty to get their doctorates, and a lot of them want doctorates. But the reality is that PA programs are exploding around the country, and as of yet, we don't have that many trained, doctorates to fill all
Mm.
those positions. So I wouldn't let people let that stop them. Maybe something they have to get eventually, but it's definitely worth at least looking into in your area. And of course, I say in your area, but now that we've gone through the pandemic, a lot of programs are actually incorporating some online components.
Remote.
I'm not saying that PA school has gone online by any means, but I've seen programs that are open to having people who are like an adjunct professor or even a guest
Hmm.
lecturer do it online. And so while you may not be able to replace your full-time income doing something like that, it can supplement it maybe to a point where you can drop down, part-time in your
It's part
clinical
time.
hours or whatever. Yeah. But beyond PA programs, like this is what I've learned as I've been going through this, and it floors me, is that PAs
Yeah.
are like, well, I can't do anything besides clinical stuff. That's what I train for. And I'm like, no, reframe this. You have a
Yeah.
bachelor's degree, and most of us have a master's. There's still some people around that went through when it was a bachelor's program, but most people have at least a master's now, and a lot of people have doctorates. And
Hmm.
those skills can transfer over to different places, and one of them they can
Oh
transfer
yeah.
over to is teaching in non-PA programs. So, colleges, community colleges, things like that. They have anatomy and physiology classes. They have all kinds of different biomedical, science courses and things.
Hmm.
So if it's not, you don't have to just think PA program. You can think other academic
Right.
stuff. And also people looking to do stuff like on the side, or like I said, looking for supplemental income. It's not going to be PA income, but tutoring. There's lots of, places where you can go tutor, and they're looking for people that have master's in science degrees and stuff. And
Mm-hmm.
tutoring, I mean, I've seen them making like $40 an hour. A lot of them may be around $25 or $30 an hour, but that's not bad, especially if you enjoy kind of teaching, if you're looking for something kind of supplemental. So
Right.
when I say academics, think about all those different options.
Mm-hmm.
And then administration, like you said, getting into leadership. And the video I just released last week, I interview a PA who went from several years ago, not being able to even find a job in leadership because they were being told that PAs aren't eligible because they didn't know what PAs do. And I think that that's still probably around in some places, but
Yeah.
it's changing. But
Yeah.
she got her MBA. She did some Six Sigma, Lean Six Sigma training, different kind of, business training. And now she has worked her way up, and she is the chief medical officer of advanced practice providers in this
Wow.
huge, well-respected, big medical center. Yeah.
Yeah.
So she's got she's up there in the C-suite, kind of like, so it's possible. And there are lots of different roles there. And, people
Yeah.
wanted to think about how they do that. She drops a lot of good hints, in the video and stuff, but really it's just starting to get involved. And at first it may be having to, not be compensated for some different projects you work on, different committees and things like that. But
Mm-hmm.
you just need to show up at your academic or your medical center or wherever you're working, your clinic, and start being a leader. And then
Yeah.
that leads to, other things. But yeah, in administration, there's lots of different roles there. And some of them are clinical and, administrative. So you split your time, and then some are
Yeah.
just, completely admin. So there's a lot of flexibility there as well. And then you talked about the medical, the medical sales. So it's,
Mm-hmm.
medical industry is basically the overall umbrella of that. And again, I learned everything I learned. I interviewed people, and I learned so much from them.
Yeah.
But I interviewed a PA who transitioned into medical industry years ago and has worked in several different positions within medical industry. And she actually has a course on how you do that and things. And I work with her, and I have links to her courses under the videos. But
Okay.
I have a couple videos with her, and she talks about, kind of how she did it and the skills we have that transfer. But she also talks about, I specifically asked her, I said, let's do one video where you just tell me what these other job titles are, because I can't think of anything other than sales or like
Yeah. Yeah.
MSL. I'm like, those are the only ones I've heard about, but I'm sure there's more, right? And she's like, yeah, there's like 50 different titles of jobs that we would qualify for that we just don't know, exist. And
Mm-hmm.
so that was very interesting in that video. And she kind of goes
Yeah.
through and lists all the different titles. And, there's a lot of diversity there. A lot of it is educating on products, or, educating on, like surgical products or stuff, or like
Mm-hmm.
medications and things like that. And then there's MSL, which is actually, a little different than that. And then there's just, I can't even remember them all now, but she listed a whole bunch. And in her course, she talks, about even more of them. And she went online, and like before we did that interview, and she put in some of the various titles, and she got like thousands and thousands of job openings,
Oh,
available. And
awesome. I
people,
was going to ask that.
yeah, yeah. And people don't realize it because they may search MSL and there's a limited, number. But within
Right.
the pharmaceutical industry, there's tons of
Yeah.
different positions. We just don't know
It's
what they are.
endless.
Yeah. So it's
Yeah.
yeah. So it's a matter of learning that. And
Mm-hmm.
then there's research. Like I interviewed a
Mm-hmm.
PA who is a principal investigator, which means he comes up with original research. He researches in cardiac medicine, and
Okay.
he still practices, I think, like one day a week because he wants to stay, in the clinic. But that's
Sure.
his full-time job, is coming up with research, like thinking about what do we need to look at closer in the world of cardiac medicine and stuff. And
Hmm.
he's been published in lots of different journals. He presents at, American cardiology conferences and things like that. So there's that opportunity, but there's also the opportunity, which probably more people would be interested in on the backside of research, is once that research studies are written up, then somebody has to actually perform those studies. And so there are companies that do that.
Yeah.
And they hire PAs to be, the person that people are coming to you just for the study. You're not managing them in any other way and things. You're just administering the medicine or the product, the medical product, whatever it is. And then you are seeing them back just to kind of catalog their different side effects, or, what's improving, what's not improving, all those kinds of things. And then you just kind of gather that data, and it gets consolidated and sent back to the researchers. So it's much more low stress type of job, but you have to use your clinical knowledge to, because you have to be able to screen the people too. You're also the person that's kind of weeding out who can get into this study. So when you see the studies advertising, they're looking for medical participants, in this study. This would be the PA would be the person who would kind of look through their background and their medical history and decide whether they actually fit the parameters for the study, and then do everything moving forward.
Cool.
So that's also, that's a cool thing to do. And in my videos, whenever I interview somebody about these roles, I always try to ask them, so how do you do this? And they give me links, or they give me, things to study or different things. So in the videos, I try to lay that out for people. And then I've talked to 2 different people that have PAs that have worked with medical technology startup companies. And that's a whole nother area that's about to explode.
Yeah. I know, my wheels are turning. I'm like, because I used to recruit in tech, and if I can find a way to blend the two, I'm like, that would be awesome, because so many people. I know there was a recent conference about it. I think Vive, that was in Los Angeles. And I've talked to some folks that are like, I want to get in on that early, right? Like, I want to know what's going on. And tech is so interesting too, because it's so whoa, and healthcare is so constant that it's like, I wonder how that will, having been in both worlds, it'll be an interesting kind of,
you would be a good fit for that, because the clinicians, may not realize, like, they think, what would I do in like a tech startup? But if they're building products and things, especially if they're going to be products that are going to integrate into practice, they need the clinician viewpoint to help
from
them
a user interface.
know what is. Is this going to work or not? Are people going to be able to handle this and adopt it? Is it something that's needed? So all those things, you're like a consultant in that area.
I think,
and I haven't interviewed. Oh, sorry.
No, it's okay. This thing is a little bit delayed, but I was just going to bounce off that point. I think you mentioned telemedicine, and I think a lot of times what happens is that, especially in private practices where they're not a part of a larger hospital system, they don't have the resources, the infrastructure of the technology to be able to provide those services is what is lacking, and why they don't utilize it, right? And I think so much of telemedicine moving forward is going to be able to say, okay, now we have these people who understand what the clinician wants to be able to use this technology for, how to implement it so it's effective, and to where they're actually going to be able to see the results and impact of it in a positive way. So I think that's where I, from my own clients, seen like, oh, we're not doing that because we don't have the resources. It's not because they don't want to. It's not because they don't have the budget for it. They just don't have the infrastructure for it.
Right. Yeah. And along those lines, one of the things I learned in the interview, talking to one of the people about, tech startups, is that not too long in the distant future, people are going to be buying kits at CVS or something that's going to have a digital stethoscope and a little otoscope. I mean, you can already buy them at Amazon to look in your ears. People are going to have that kit at home to do their telemedicine, so that when they, call their provider, and it's going to be like ubiquitous, like everyone's going to have it in their home, like they've got a thermometer at home, and like people have blood pressure, machines at home. Yeah, it's just going to be a kit, and it'll plug into your computer. And when you talk to your provider, they want to listen to your heartbeat. You put the little thing on your, chest, and they'll tell you where to move it around, and they'll be able to hear your heartbeat on the other end. They'll be able to look in your ears, those kinds of things. And so all of those products, probably need clinicians to help them in developing them.
Right. Right.
and to understand what's usable, not those kind of things. So yeah, it's exciting. It's an exciting world. And I think that if people are interested in that, to really, start studying up on the
Hmm.
technology that's out there, and understand, taking um, courses, on AI and all those different things that are coming, and really, get
Yeah.
knowledgeable about that, so that you can seamlessly transition into those roles. And again, I'm plugging videos, but
No,
I've
I want you
there's
to.
so
This
much.
is a
I
resource for
know there.
people.
Yeah, there's so much information. I did one about using clinical skills in a non-traditional way, or something. I can't remember the exact title of it, but she talks
Yeah.
about that because she's worked with tech startups in the
Hmm.
medical realm, and she talks about all the different skills that we already possess as clinicians that we don't even realize transfer to the business world, especially
Right.
to med tech startups. And she kind of goes through and lists them, and so that when you look at a job posting for these startup companies, and they're looking for, somebody who's a project manager, and someone who has, all these different terminology that we don't use, she talks about it's the same thing that we do, it's just different
Right.
terminology, and she helps connect what we do to that terminology so that you can
Yeah.
transfer it to your resume. So it's
Yes,
fascinating stuff, and so much opportunity there. And
there
just
is.
really quick, I won't even mention medical consulting, being a patient advocate. That's a new thing that's coming. And
Hmm.
I don't have interviews on those yet, but I've talked to some people, and hopefully in the future. But that's what I'm saying, like, just get excited, because the positions really are endless. There's tons of different opportunity. You just have to change your mindset, understand your skill set, and start looking for these
Hmm.
opportunities in a different way than what your traditional job searches have been.
Agreed. Yeah. And I think creativity and, like you said, mindset is so important because having worked, I mean, I primarily worked with tech startups. That was my world for many years. And there's so many different titles and fluff just because there's no structure going on. Like when I tell you there is absolutely, it is the wild, wild west day in and day out. And so it's this whole new philosophy around thinking. And I remember I have family members that are healthcare providers, and we are like polar opposites when it comes to this because my world has always been like you zig and zag and you go and you've got it every day. Like there's something new and the policy that was yesterday is different today. And in hospitals and healthcare, it's like, this is how you do this. And then you move to this step and
Right.
then you do it this way. And then when you go here, you do it this way. And the two worlds colliding is so funny to me because they couldn't be farther apart from how they actually go about their day to day and doing business. So I think also ignore the titles of job postings always in general as a general rule
Hmm.
of thumb, but especially if you are looking to transitioning out of patient care and or splitting your
Yeah.
time, do not let that stop you because when I tell you I worked in startups and we would hire somebody and pretty much let them make up their title based on keywords that they
Right.
probably like researched on Chat GPT, and they thought like, if I have this
That
long
sounded good.
title, yeah, it sounds really cool, and I can post it on LinkedIn and tell everyone I'm excited to share that I'm the chief technology security backend. It's like, what?
Yeah.
You're a security engineer.
Right.
So, I mean, just take it with a grain of salt because I think the two
Yeah.
key differences between those industries is just the rigidness and how they operate are two very different things. So,
Yeah.
not letting the titles and the qualifications under the, bullet points stop
Yeah.
you from exploring different things.
Yeah. Because, as a PA or a medical professional, we're gonna have those bullet points, and we're gonna have a highlighter or a check mark. We're like, okay,
Yeah.
I've got this one. I feel pretty solid in that one. I can show these things, and we're gonna do that. We're gonna go through each one. When there's probably some 20 something year old who's like maybe taking a few business courses, said, oh yeah, I do that. I talk to my friend Mo all the time, and we talk about how we can do this. So I've got experience in doing that. I'm good, and they go into
Yeah.
that attitude. And I'm not saying it's wrong. I mean, it's just like you said, we're too rigid, I think, and we
Yeah.
undersell ourselves and our skills left and right because we only
Hmm.
have that focus of my value in the medical world about seeing patients, and
Yes.
that's the only way we look at it. So it is funny.
And I think I've seen a statistic where women actually in the workplace only will apply to a role if they meet, I think, 90 or 95% of the qualifications. And for men, it's like, it could be 10%. And I'm not saying like,
Right.
there's nothing wrong or right about that, but it's just to say that
Right.
I'm a recruiter. I get applications all the time of people that are not good fits. And that's okay, because I've applied for jobs that I was underqualified for, and I got it because of my attitude, my willingness, and my drive. That's it.
Yeah.
And so you have to understand that sometimes it's about who you know, but it's also about your ability to come to that interview and say, hey, look, I actually have no idea how to do this role, but I can do this, this, and this. And here's how my clinical skills will translate to this. And I'll make sure that I show up every single day. You know, there's a million and one ways that you can go about it. But I think small plug for myself in my business and what we do is that recruiters can help you kind of figure out what I call FAB statement is, a features. And so that when you do go to apply, if you don't meet some of the requirements or you feel like you're having imposter syndrome, you can still present yourself in a professional way that translates well into the role, even if you haven't done that role. Right. And especially where there is so much demand and a lack of supply in some of these positions. I mean, you'd be crazy not to, right? So, I mean, if you feel like you are wanting to take this route and you want to have a conversation with me, you're listening to this and you're like, oh, I might want to tutor with that. Yes, we primarily recruit clinical side, but I've been in tech and I understand the scene. So if you're like, I just want to bounce a few things off of you or what titles or whatever, feel free to reach out to me because I think so much of our limitations are self-imposed. They're not actually limitations.
Yeah. Yeah, exactly. And I was just thinking that, you know, like earlier in the conversation where we were talking about maybe not give up on clinical practice yet, that maybe you just haven't found the right fit. I think working with someone like you, and I haven't worked with you in that kind of capacity, but I've had a couple conversations with you, and I get the real sense that you're somebody who's going to listen to what the person wants and really help them find the right fit, because I think that's what it comes down to, being happy in your job. Like I said earlier, no matter if you're in, you know, clinical or non-clinical roles, is finding the right environment to work with the people who are going to give you what you need, whether that is, you know, a lot of handful holding or whether it is complete autonomy. You know, having somebody that understands what the client is looking for and that can talk to the clinician and what they're looking for. I mean, I assume that's always what I thought recruiters do, is kind of make the best marriage that they can, like matchmakers. That, you know, people looking for the same
thing. I try to do that in life too. And I will say, okay, this is a true story. My childhood best friend, like we were attached at the hip, we were neighbors, is now married to my brother. And how they got together, I was married and divorced, but how they got together was at my wedding. I might have been 2 wines deep, but I looked at my brother and I said,
it's your wedding.
I said, go ask Tori to dance. And she was like, or my brother said, she's not going to dance with me. And I said, oh yeah, she will. Go ask her to dance. And they danced. And the next week I got a phone call from my mom that said, well, Tori came to the house today, but it wasn't for you. And I thought, well, who was it for then? She said she was hanging out with Brad. And now they're married and have a kid. And I'm like, you are welcome. So, you know, I like to think that I've got a good discernment when it comes to people and what they're looking for and personalities, which is what I think is the right way to do it. Because anybody, if you've graduated PA school, you are bright enough to figure out anything. It's a means of figuring out what your motivation is, what you want, and how to pair you with someone that's going to provide you with that. Especially as a new grad, also collabing with somebody that is going to see your value in the healthcare ecosystem and provide you with proper mentorship and training. But, you know, not every recruiter sees it that way. And so I am somebody that understands that 99% of recruiters absolutely suck. And that is just because most of them don't come at it with that approach.
Right. They're just trying to get a warm body in there sometimes.
Yeah, they're just getting the invoice. That's why I don't like locums, because it's like just quick, like, let me charge the client $120 and only give you $100, and then I'm making $20, and I don't really care if you stay or go because I'll just find another person to do it. And but I understand the flexibility.
It can be that side of it. Yeah. Yeah. Well, and I know I'm actually going to interview you on my channel. We're going to talk
Yeah.
more, about recruiters and, using them. I had a good, well, I say I had a good experience. It was my first job out of school, and I was a flexibility to go anywhere around the country, and I didn't know where to start. So I worked with a recruiter, and I have to say though that I think that they set me up with somebody who was also saying the right things about like wanting to mentor and stuff. And I think she had great intentions. It just didn't pan out because she was so busy, herself. But the recruiter did listen to what I was looking for, because I said that's what I really wanted the most, was a mentoring, situation. And so he found somebody all around the country in this small little town that was saying the same things, that they wanted somebody to grow into the practice, and stuff. So, I do think that it can be right, but you got to find the right person, somebody like you who cares, right? And who cares about, and you have you have PAs and medical people in your family too. So you know what it's like from the, from the clinician side and stuff. I think that gives you a little bit of more, not edge, but like you care a little bit more because you understand it's personal.
Yeah. And I mean, I think too, I'm a recruiter and I own my recruiting business, but I've also worked internally with a nonprofit hospital. So I understand the outcomes, right? Like I understand that if somebody isn't a match, like what havoc that provides, not only on the practice and patients, but also on the provider now having to go through credentialing again and licensing again with a new place. And I mean, it's just, why do all of that, and that's why we just primarily focus on full-time direct hire, because I'd rather just focus on that and not have the headache of, but we can talk about that all on your channel as well.
Yeah, we'll get that in that other interview.
Yeah. Awesome. Well, this has been awesome. I think this will shed a lot of information, insight, and hopefully also motivation for those who are trying to explore different things, different avenues. And, of course, I'll link all of Michelle's information so that if you want to connect with her after, I will also include some of the links to her YouTubes that she was talking about on this episode so that you can reference back to those things. And obviously check out the episode that we'll be doing together. And I'm not sure when that will go live, but we'll make sure that is sent out to listeners as well. So thank you so much for coming on and sharing all this knowledge and wonderful stuff with our listeners so that they can hopefully, have a place to start.
Yeah. Well, thank you so much, Maddie. I appreciate the opportunity.
Yeah, of course. All right. Until next time, everyone.
Thanks for listening to the Healthy Careers Podcast, where we provide a platform for you to ask hard questions and get real answers. If you enjoyed this episode, don't forget to subscribe and share it with your friends. Stay tuned for more episodes every other Friday at 7 a.m. Eastern.